Hello friends, this is DrRBKushwaha, professor in the Division of Veterinary Clinical Complex at FVSC and AH, Sports Jammu, Araspura. Welcome to my YouTube channel, and if you are new to my channel, so kindly subscribe the channel and hit the bell icon for further notification. So today we are going to perform oral hematoma in a 6-year-old dog. So now you could see we have prepared this left side of the ear for the aseptic surgery. So we have properly shaped the hair from the dorsal surface. This is the ventral surface, and we also shaped the hair around the base of the ear. The oral hematoma, this oral hematoma is nothing by definition. It is a collection of blood between the cartilage and the inner side of this skin. So this is the ventral surface of the ear, or it is the inner surface of the ear, or in other word you can say it is the concave surface of the ear. This one is the outer surface, or this is the dorsal surface, or in other word you can say this one is the convex side of this ear pinna. So this one is the proper skin, and this one is the very thin and pliable skin here. So basically the blood is collected between this skin and the cartilage in between this both skin. So whenever we give the incision, so we always give the incision at the ventral surface. We never give the incision on the dorsal surface. So this oral hematoma is resulted after any traumatic injury. That trauma may be self-injected, and it is mostly there are the certain predisposing factor, and the ear mites and the external parasite infestation in the ear canal, or any type of irritation in the ear. So sometime what happened, dog try to scratch, and during that there is a trauma to the caudal auricular artery. So this hematoma is basically what happened. The caudal auricular artery supplied from this dorsal surface, and there is a hole in the cartilage. So from that hole their capillary is basically enters, and it supply this ventral surface of this skin. So during trauma what happened, there is a separation, or there is a splitting of sometime this cartilage, and what happened, there is a collection of the blood. Once the equilibrium achieved, so what happened, the blood oozing stopped. But what happened, there is a continuous habit of the shaking of the head or scratching. So what happened, there is a further separation or scratching resulted into the negative pressure here, and there is a further accumulation of the blood. This continuous process leads the full length oral hematoma. So now you could see here, so in this condition, if I palpate, so here, so from this level up to the base of the almost base of this ear and this tip and this lateral surface, so there is a full length oral hematoma. Before making an incision, we should always insert this sterile cotton or even the normal cotton before you can say preparation. So this will, you can say, prevent the entry of the whatever you can say blood which outside, so that will prevent to enter into this ear canal, external ear canal. So here the incision, whenever we give the incision, so we give the incision in the center of this ear pinna. So the center is here. So we start from the hair and we down this ear down, so that whatever the content ooze out, it doesn't, you can say, enter into the ear canal. And you can also keep the one gauze piece at the dorsal surface. The moment you give the incision, depending on the duration of this oral hematoma, so now you could see here, so this is the only, as per the history, the 7 days old oral hematoma. So there is a clotting, but there is this is almost right time to perform this surgery, because if you perform too early, so there will be a bleeding, and if you perform too late, so there will be chances of the fibrosis of this, because of the presence of the granulation tissue in this space. So if you have the tincture iodine, then better to pour the tincture iodine and then clean like this. So this operation is not a very, you can say, a difficult operation. It is a routine and very easy procedure, but there is a lot of principle you have to follow in the oral hematoma, like where you have to give the incision, whether the incision should be very small or long. Here if you see, so we can extend the incision a bit toward the tip side. Okay, and the most important is suturing, because in this operation what a surgeon do, basically we obliterate the space between the this pinna and this skin, because collected blood created the dead space. So drainage and prevention of the dead space. So there are several techniques for the management of the oral hematoma. There are some conservative treatment in which they drain the, you can say, and they apply the pressure bandage. Some people they tried with the staple suture, button suture, even the punch biopsy. They just take the punch here and here and they release the this blood as serum which is collected, and they do the pressure bandaging. It means overall whatever the technique apply, the pressure bandaging is the must. The most common method of management of oral hematoma is the incision, the linear incision in the center, and the full thickness U-shape suturing or mattress suturing, through and through mattress suturing in the skin. So this is the widely accepted treatment. So before through and through suture application, we should pour this tincture iodine, or even if you don't have the tincture iodine, then this 5% povidone iodine is also sufficient. So next step is we start suturing. So whenever you start suturing, suturing should always be started from the periphery of the ear pinna. We should never start from the center, because if you start from the center, so there may be chance that a little bit fluid may collect in between the suture. So it is always start from the periphery. So this is the very important point. So first we start from the here. So now the most important part of this suturing is that you should never apply the pressure too much, but at the same time it should also not be too loose. Okay, very good. Now you enter the second bite 1 centimeter away from this one. So and also in the same line here. So like this. And then 1 centimeter here, and then like this. So this straight needle is really very helpful, and we always put the knot over this dorsal surface or convex surface. So during through and through suturing, so the oozing of the blood is common phenomena in the oral hematoma. So we should not feel very odd or awkward whenever there is a mild bleeding during when you take the bite. Because here intention is to just obliterate the dead space. hold from the tip, yes. The minimum 3 throws should be there, or even you can apply the 4th row. So now the second row. So here this is we started the suturing from the lateral surface, from the periphery, and then we have to suture in the 2 or 3 row depending on the size of the hematoma. So here the second row, the matter suture second row should become here. Where in the first row, if suppose we have applied here and here, so in second row the suture should not be, you can say, put the suture in just beneath this suture. Otherwise, if you apply like this, so what happen? There will be a dead space in between this area. So obliterate the complete dead space. Now the second row you will start suturing in between this one, and you always take the distance also. Hold from here. Okay. It's oozing of blood from here. This one. So now the second from here. So second bite is like this. Then you turn. There is a lightning of anesthesia, please someone. Then third one is very close to this incision. So the third row, we will apply here only, here, and one suture here. So because the separation up to this level, so it means the third row we should start from here. So this oozing of the continuous oozing of the blood is from the incised skin. Keep on moving. So here it is the slip knot. If you insert the here artery forceps, so definitely you will find that the one tip of the artery forceps is easily, you can say, So it means the suture is not tight. And the after through and through suturing, the most important part is the bandaging. So that will I also show you how we bandage. So now you could see, so we have repaired the one side of this half of the, you can see here, panna, and now this inside we will repair. So after repair, this ear should looks like this. So again here we start the suturing from the periphery. So the separation up to this level, hold like this. There are so many techniques of this augmentation of dead space, but still this through and through suturing is the most common and economic also. So it is very important to take the straight needle. That is very helpful. Otherwise, if you take the curved needle, so what happen at one side, the length of the suture is less, and other side is the either the bigger or the smaller. So you will not find the uniform. Here, if you see, this distance and this distance is same because of this using the straight needle. So this surgery is right now assisted by Nasreen Fatima, PG student, and anesthesia is looking by IPSA, and guarding is being done by the internship student Jahid and Saksham Gupta, final year student. So now you could see, so we have repaired this first row. Now the second row, so we start from here. So in most of the animal, 3 rows is basically on the either side normally require. Please cut it. The second row should be in the same. Please give the anesthesia. Animal is recovering. Now they could see here, so there is no bleeding here now. The oozing has stopped. So now the same, you can say, ear pinna now looking very good. So obviously, whenever there is a continuous oozing of the blood at the surgical site, so it doesn't look nice. This is the, you can say, problem seen during this suturing. in case of the oral hematoma. So as far as the medicine is concerned, so after this surgery we'll give the antibiotic analgesic, and we also give the some anti-allergic drug, and maybe the one shot of the ivermectin also, because we have to also prevent this predisposing factor for this oral hematoma. Otherwise what happens, there will be recurrence after some time. So now next step is we'll go for the bandaging. So for bandaging we have to remove this drape. And moreover, this animal also having this hematoma in the right ear also. So after this we'll perform this one also. So I just told you ki for the compression bandaging, you can apply here the triangular shape cardboard here, and then you tape. But I here used to prefer this one. This is the 5-inch bandage, cotton bandage. So I used to do like this, and then first we fix with the tape. Please apply the tape here. And I have already painted this area with the tincture benzoin for the adhesion of this one. Okay, now cut it. This bandaging is equally important. You should not, you can say, underestimate this bandaging in the oral hematoma. This is very, very important. So now you could see here, so this one is the larger, so we cut with the blade. Kindly give me the blade. So please, so we'll cut here. So whenever you cut, always take care of this pinna. So even you can apply any topical antiseptic solution here. So we will apply the betadine. Kindly give the betadine in the cotton gauze. This one will be keep here, and here you just give the betadine. But sufficient. So here we'll pour this bandage like this, and we can also pour here. Now we keep like this, and then we roll the ear like this. Now you just roll the adhesive tape around this pinna. Apply this adhesive tape. Remove the gloves. Even I have to also remove the gloves. So earlier I was using this triangular shaped cardboard, but now I am using this one from last few years. So this one is I found effective. yeah, better than the cardboard. With the gentle pressure, not last one is toward the base like this. So this is the tip of this pinna. So you apply one like this, starting from the hair. So since we are going to perform this side up also, so after this then we bandage both like this. Otherwise if it is only one side, then after that what you do, you just put like this and then go for the bandaging in the neck region over the paw, maybe go through the figure of it. So once now the Nasreen, Fatima and other pigeons, then they will perform this surgery, and the final bandaging I will show after finishing this one. So now you could see, so we have also repaired the small ear hematoma in the right ear here. So this one which I repaired first. So now we are going to bandage this one. So we should fold the ear pinna on this dorsum like this. So here this is the both side. So there may be chance that there will be difficulty while doing that, but first I will secure the bandage here, and this here in the neck region we should apply with the light pressure, gentle pressure. So first we engage this bandage and then we cut the hair to make the hole. So here the bandaging you can't do in the gloves, so that's why I deliberately remove the gloves here. So now we keep the hair, we keep the ears in the opposite direction like this. So this is the very important step, because sometime when you perform the surgery nicely, you applied the suture as per the protocol, but what happened if you not apply this bandage, pressure bandaging, if you not do the pressure bandaging appropriately, so what happened? So there will be recurrence of this one. And here how you judge that? If you keep the finger here, so it is very easily going, it means there is no pressure over the neck. So we apply another one here. And dog usually have the habit to shake this head because of this suture and all that, and moreover in this case there is a bilateral oral hematoma, the both side of the ears affected. So this is equally important. You should not take this bandaging lightly. So some of the subscribers, they are requested for the video of this case, that's why I recorded this case. And as far as the video of the other cases which I have made only for the members only, if you want to see those videos, so you can also become the member of my channel and you could see those videos which are actually for the members only. So this is how we fix this one, and next step is to we apply the Leukoplast tape here and here in the figure of 8 for the further secure. This is the Leukoplast. Don't use it. Just to secure the on top of this ear pin, we apply the crisscross pattern. So now it must secure this pressure bandaging. Even after this, we will advise owner for putting the e-collar in this neck here. So this is all about the complete video of this oral hematoma, means starting from the preparation, then surgery, and then the bandaging of the ear, and then the securing the both ears over this whole region. So thank you very much for watching this video, and if you are new to the channel, so kindly subscribe the channel and don't forget to press the bell icon for further notification. Thank you very much.